Gonna be all over the internet.
Okay, so we're gonna do
I know, seriously.
ankle, plantar flexion, dorsiflexion, inversion, eversion. I'll show you the first four on the table, and then I'm also gonna show you ankle dorsiflexion standing. That's actually, I think, more clinically relevant because when you're standing in weight bearing is when you're gonna get a more accurate functional movement. Normal ankle dorsiflexion is reported as 20 degrees. I don't think I've ever personally gotten ankle dorsiflexion 20 degrees in a non-weight bearing, but I will get that in weight bearing much more easily. Actually, can I use your other foot just so that I think they can see a little bit better?
Oh, excuse my
Oh, good for you. I like it.
Yeah, that happy face.
So
is
you're
very
gonna keep-
clinically relevant.
I don't know if you can do like this or something that's more comfortable. Just put your foot here and relax. There you go. I'll move out of the way too. So you're gonna keep the knee in slight flexion. So you can either use a towel roll or a pillow just to keep that knee in slight flexion so that you're not getting gastroc limitations or other muscular limitations when you're doing dorsiflexion. Your axis is going to be lateral malleolus. Your stationary arm is going to be along the fibula up towards the fibular head, and your moving arm is going to be along that fifth metatarsal for both plantar and dorsiflexion. Like I was saying, the normal, you're going to push through the first four rays or metatarsals, whatever you want to think of it as, and I would be on this side so that I can see what I'm doing. I just don't want to block the view for you guys. Stabilizing at that distal tibia fibula, coming up, making sure no pain, firm and feel, any pain, discomfort. And then I'm gonna look, to me, this looks like it's about 7 degrees of dorsiflexion, again, in that non-weight bearing, but the normal doesn't change. So I'll preset my Goni. I'm gonna come back. Again, any pain? Nope. Oh wait, I'm going the wrong way. On my Goni. There we go. And I would say she's at 6 degrees of ankle dorsiflexion in the non-weight bearing. I'm sorry, am I totally blocking? Sorry. So then ankle plantar flexion, again, same setup. You're not gonna have to move them at all. Normal is 50 degrees, and same landmarks of the lateral malleolus up along the fibula, along that fifth ray. This will also be a firm and feel any pain there, and again, on the lateral side that you can see. For her, she looks like she's actually about 75. So I'll preset my Goni. Also, remember where you're starting, what numbers you're starting at, and which ones you're looking at. If you look at this number, it looks like you're looking at 155, but that's not the number you're using. So again, practice with your Gonis, make sure you're familiar with what numbers and what sides, whether the inside number or if you're subtracting a number or all those other incidences that factors you have to think of. Good. Anything? Nope. And then also try and make sure they're not coming into like inversion.
Extreme close-up.
home video.
That's home video.
Yeah. You just been on it on punch.
Making sure they're not coming into inversion or eversion, so maintain that neutral inversion, eversion. Doing okay? Yep. Any pain? No. So good.
For bonus points, did anyone get the extreme close-up reference?
Oh yeah, extreme.
And I would say she's at 80. So what was my estimate?
70.
70, 77.
What was
okay.
normal?
50.
50. Oh.
Okay, so then for inversion, eversion, you want them to just be kind of in resting dorsiflexion, plantar flexion. So you don't want her fully plantar flexed. You don't have to get her into 0 because that can actually limit some of that motion. So a neutral, loose pack position. for ankle dorsiflexion and plantar flexion. Don't.
You're on ceiling cam now.
Oh, good. Man, look at that. Quick little swap. Can you scoot? Perfect. This one, you're allowed to leave the Goni and move the foot with the Goni. So your axis is going to be that dome of the talus that we were working on, up along the tibial crest, along that second ray for moving arm. Did everyone catch that? Axis, talus, stationary along the tibia, moving along that second ray. And this one, you are allowed to move the Goni as you're stabilizing, still at the distal tib fib. And I'm gonna move into E version. Any pain? Nope. This one can be firm or hard, again, depending on patient's mobility. You might be running into that lateral malleolus, getting a bony block there. I actually feel more firm on her. And I'm getting 30,
Watch your head.
sorry, 34 degrees. Normal is 30? I think it's
30.
Or no, eversion's 15, inversion
Sorry, eversion is 20.
20. There we go.
Inversion is 30 to 35.
There we go.
Wow.
So yeah, 30, sorry, again, not trying to block you guys. And then same hands, same setup. You can again leave the Goni where you are along that second ray, neutral, loose pack position. Any pain? And I'm getting, sorry, 40, what was that? 4.
Is it firm?
This one's firm as well, sorry.
So either or for both.
No, eversion can be firm or bony. Inversion will be firm.
So inversion is 30 to 35, eversion is 20.
Yes.
Is that why when people that evert really bad can crack their lateral malleolus?
Yeah, you can get that bony avulsion fracture, or stress fracture of some kind. And you also have really strong deltoid ligaments, so that's why you get more limitation in that direction. Okay, and then really quick, let me show you the standing dorsiflexion. So this is much, like I was saying, this is much more functional. You're actually, and you should see a lot more motion here because you'll get more midfoot pronation, so you'll get more collapse of that arch, which will allow some of those bony structures to get out of the way, and you'll get more motion. This is where I tend to see much closer to that normal expected 20. However, your landmarks don't change, so you'll still have lateral malleolus, fibula, fifth ray for your axis, stationary, moving arms. Okay? So have your patient do this. You're just gonna have one foot in front and you're gonna have them do kind of a half lunge as far as they can. This one, it's harder. You're not actually gonna feel an end feel. You can kind of put a little overpressure on that posterior knee. I guess that's how you get your end feel. Same firm end feel. So would you mind doing that? And you have to make sure they're not bringing their heel off, because if their heel's coming off, that's a different motion. Any pain? Nope. So you can get a little bit of a firm end feel there. Palpate. To me, this looks much closer to that 25, and I'm actually getting, oops, up here, 22. 20 is the same, doesn't change.
Same landmarks?
Yes, same landmarks.
On the practical, do we choose whether we want to do it
I
weight
don't remember
bearing?
how we did that.
We choose.
We choose.
Okay.
We'll tell you weight bearing or non-weight bearing.
Okay.
Do you have to track, like, to make sure the knee stays in a particular alignment? Because if the knee goes in, like, you could get more range of motion?
Well, so I was watching the heel, because if she goes in, that heel tends to come up.
Oh, good point.
So just, you can even, if you want to put just a little downward pressure to make sure that your heel stays there. But
yes.
if she starts diving in, then that lateral heel is going to start raising.
Gotcha.
Why would we do this in one version as opposed to another clinically? What's up? Yeah, very good. So you would more likely do the first version on the table in a patient that isn't weight bearing for some reason. Maybe there was some sort of surgery. You know, maybe it's like post like some sort of Achilles repair, and you're just able to start doing some range of motion, but they're not bearing weight yet. Fracture, you know, something along those lines. Whereas if you're working with someone who's a little bit more functional, maybe you're looking at their squat and want to see if they have sufficient anterior tibial translation to get deep into a squat. Runners, you would want to do a more functional test like this.
Questions about those ranges of motion? Cool. Let's practice that.